6 factors for a delayed recovery from a concussion. Number 1, a previous history of concussion. In some cases, if one has had multiple concussions previously, the effect can be cumulative and there may be a delayed recovery with a subsequent concussion. However, this is not always the case, and it's possible to have a history of multiple concussions and recover within 1 to 2 weeks from a subsequent concussion, but the risk is higher. Number 2, a previous history of mood disorders or depression or fibromyalgia may complicate the recovery from a concussion. Number 3, a history of anxiety. Invariably, you will find patients who will state that following a concussion, their anxiety levels have exacerbated. In some cases, people don't recognize this because they will think, well, this person already had anxiety before. But if you look and examine closer, their anxiety levels, often following a concussion, shoot through the roof. Number 4, a history of attention deficit hyperactivity disorder, or ADHD. Children with this diagnosis or these tendencies, in some cases, take longer to recover from a concussion. Number 5, age greater than 70. In some cases, we see an acute cognitive decline following concussions in individuals over the age of 70. For example, I recently had a corporate lawyer that was over the age of 70, sustained a concussion, and developed acute cognitive decline. He was unable to remember his clients, engage in conversations, and others had attributed this to his advanced age. However, he was clear that prior to the concussion, he was functioning at an extremely high level. Therefore, it's important to bear in mind that concussions in the elderly can have acute effects. And finally, number 6, a dark room. Staying in a dark room for extended periods of time in order to recover from a concussion is not the current management of concussions and can further delay recovery. To take this one step further, some people believe that they should not return to work until they are 100% fully recovered. In fact, it is important to engage in moderate levels of cognitive and physical activity, and in some cases, returning to work with the support of the employer, the family, and the health practitioners with moderate levels of cognitive and physical activity and avoidance of exacerbation of symptoms can actually improve recovery. Therefore, avoid the idea of being in a dark room. Gently engage in cognitive and physical activity in moderation in order to promote your recovery. Understand that in certain circumstances, returning to the workplace in a graduated modified basis can enhance recovery, and gentle return to exercise and sports can be beneficial. 6 risk factors for delayed recovery from a concussion.